really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Good morning, or afternoon, or evening, depending on the time of day.
Good morning.
It's Dr. Natalie Keith.
Dr. Josiah Dame.
And this is Vet Tales. Today we're talking about diabetes.
Yes, and you will probably hear construction in the background.
Yeah, we're really excited. We're watching them work out the window right now, and it's
pretty awesome.
It's pretty awesome. These guys are legit, well-oiled machine.
Yes.
It's astounding.
And the building is huge.
Yeah, it is. Our original building was, it's technically 6,000 feet, but part of it was the shop, barn area where we would put horses in.
Half of it.
A lot, yeah. Yeah, so it's probably Tracy estimates actually technically 5,000 functional square feet, and now we're going to have just shy of 8. So it's going to be great, and it's going to be soon, and I hope that guy doesn't fall down.
Don't look.
Don't look. Oh, gosh, we should have closed the blinds. The anxiety. I don't know why we're pulling on that board, but anyway, I wish you guys could see it with us. You can if you want to drive by 121 West 45th and watch the show. It's going on all day. Okay, so what were we talking about? Diabetes, unquestionably. Also, I'm excited because it's at some point in the middle of this episode, we're going to play a clip from an actual interview with a client whose pet recently became diabetic. So that's a fun twist on today's episode, and we've got new product announcements that are really, really exciting.
Yes.
So we're gonna crack into all that. If you don't have a diabetic pet, you might still find it interesting. And if you have a fat cat, you might have a diabetic and you don't even know it.
Yeah, me. I don't want to look.
Yeah, great idea. Yes, I love that.
Have you ever had a diabetic pet?
No.
I have not either. It's
I did. I had one, and so I had to pull back from old memories. But yes, it was my husband's dog, so I didn't actually do the injections, but she was a border collie that we paid bukus of money for. Her name was Angel, and she was supposed to help with because my husband at the time was working on a ranch for with mama cows, 200 mama cows, and he was going to use these 2 dogs to help round up the cows or whatever with his horses. And I was like, she doesn't look great. Something's happening. This is 2 months after we get this dog, and she was older. I mean, not old, but 6. And I was like, oh smokes, this dog is going to be diabetic. And which is fine, except for that a lot of diabetic dogs immediately get cataracts. And so she immediately got cataracts, which is really difficult to, Anyway, I blocked that out temporarily.
Yeah.
Good old Angel.
I've never had a diabetic.
Yeah, and her brother's name was Twitch. If you remember the OG pictures in the original clinic when we very first opened, there was a picture of the 2 border collies lounging on the hay bales. That was Angel and Twitch.
That's awesome.
Back in the good old days. So, what about you?
No, I've never had one. I have a fat cat that I can't get to lose weight. I feel for everybody who comes in. They're like, I've tried. And I'm like, I get it.
How old is your cat?
He's only 2. And
wow.
I have a 2-year-old and a 3-year-old cat. And one of them is skinny. It's the classic tale. One of them is skinny and one of them is fat. I meal feed them. But the fat one figures out what to do and steals. And so I'm going to try to maybe look at Black Friday deals. And they have microchip feeders for your cats, and I'm going to put the skinny cat's food in the microchip feeder.
It's not a microchip. It's in their collar, right?
It's in their collar, yes.
Yeah.
So, my skinny cat wears a collar, my fat one doesn't.
They do this with dairy cows and stuff.
Yeah. So, basically, it'll open for Salem, but not Mateo, because Mateo is eating everybody's food.
Yeah. I mean, the other alternative would be enclosing one cat in a different room during mealtime and then picking up all the food, which is a lot of work when you're a working guy and, you got the baby at home and, who needs that kind of drama in their life?
I think I'll look into the bowl.
Honestly, my kids are lobbying for a cat right now, and I'm like, the litter box, guys, you don't understand. You don't understand. So we're like, because our cat that we had forever and ever, he passed away when Madeline was first born. So it's been like 4 years ago now, and it's just like, man, the perfect cat is hard to replace.
It's really hard to replace.
Not that you can ever replace a pet, but you know what I mean. Like it's you're like, I'm never gonna get there again.
I tell people all the time I hit the jackpot twice.
Yeah.
So I don't want to risk it. Like both of my cats are amazing.
Although I do hear people say all the time, they say, I don't like cats, I just like my cat.
Yeah.
But so many people say that, I just start to feel like that it's just that you didn't think you like cats, but you do.
I do. Because I like a lot of cats.
Yeah, I know oh gosh, I have such a soft spot for kitty cats.
Right.
Okay, back to diabetes.
The reason why cats are being talked about is because diabetes.
I know, and we underrepresent them on a lot of our podcast episodes, but diabetes, man, it's their time to shine.
Yes.
Although my client interview is about a dog, so we will hit dog stuff too, and cat diabetes and dog diabetes are wildly different.
Wildly different. Dog diabetes tends to be more dicey most of the time. I feel like cat diabetes.
Yeah, I agree.
Yeah, it's more manageable, but we will talk about why.
Yeah, let's do it. Okay, so first of all, diabetes, what is it? We're actually referring to a disease called diabetes mellitus, which is different than diabetes insipidus. They sound the same and they're completely different. Diabetes mellitus is a condition where, for one reason or another, whether it's type 1 or type 2, there is too much blood sugar, so hyperglycemia, and then that is being translated into the urine because the glucose overflows and spills into the bladder. So you have persistent hyperglycemia, and glucoseuria is the technical definition of that. And there's a couple of different reasons why it's happening. If you're a dog, it's probably because you have type 1 diabetes, which means that your little cells inside the pancreas that are supposed to be making insulin, for some reason or another, have died or were not there in enough number to begin with. Mm-hmm. And it could be like an immune-mediated attack or chronic inflammation from chronic pancreatitis, or just the way you were born. And so those animals are completely insulin dependent.
Yep.
You want to hit type 2?
Yeah, so type 2 is going to be more like a persistent hyperglycemia where your body's almost exhausted. You're exhausting those cells, so you become insulin resistant.
Yeah.
Which is why that some cats, when treated for a period of time and you kind of give your pancreas a breather, they can go into remission of diabetes and sometimes never go back onto insulin or other medications, which we'll talk about.
Yeah, and I like to think about it in terms of, like, I don't do human medicine. I'd like to start the sentence by saying that and then follow it with, if I were to liken it to human medicine, like our children with diabetes, those are almost always type 1, and type 2 is what adults get because usually diet, although there are variables in there as well, but again, like just constantly your blood sugar is staying too high, and so then the pancreas is constantly trying to secrete insulin, and then it just gets so worn out and it never gets to rest that those cells just get exhausted, but that doesn't necessarily mean you're completely insulin dependent. It could be if you manage your blood sugar in a different way by diet regulation, that your pancreas can actually recuperate.
Yeah. Which is why when we do diagnose dogs and cats with diabetes, a lot of times the first question people ask is, well, is there a pill or is there something oral I can give? Because they don't want to do the shots, understandably. And just until recently, we've had to be like, no. But because people have a pretty good understanding of diabetes, definitely type 2, that, that was never really an option, but we'll get into that a little bit later.
Yeah, and even in human medicine, there's a lot more oral options. And so we're actually kind of just piggybacking onto that for cats. Does not work for dogs. So for dogs, we're basically, if you have a diabetic dog, essentially what you're going to notice before anything else is probably drinking and peeing more, and possibly weight loss, even though they're eating quite well, and maybe even seem excessively hungry. They're probably middle-aged to older dogs most of the time. And then you're going to be mad at your dog because it's peeing in the house. And then you're going to come to the vet and you're going to be like, why is my dog peeing in the house?
Do they have a UTI?
Yeah, do they have a UTI?
Maybe.
Probably. A lot of dogs actually will present with a UTI because there's so much sugar in the urine.
Yep.
The bacteria is like nummy.
Yep.
And they grow and flourish in the bladder. So a lot of times you will have concurrent UTI with an initial diabetes diagnosis. So that is kind of your classic tail
Dog presentation.
Yeah. And then if you're unlucky, you might actually find out because your dog had concurrent pancreatitis, because we talked about the pancreas is where the insulin's coming from. And also the pancreas secretes a lot of digestive enzymes and the other kinds of cells that it has. And so if you have if those cells get angry, it's called pancreatitis.
Mm-hmm.
So if you have pancreatitis and you have an undiagnosed or unregulated diabetic at the same time,
you're on a slippery slope.
Yeah, oh gosh, it's terrifying.
Yeah, this is where I feel like cats don't typically present this way.
No.
So dogs will sometimes, and this is where I would say that, dog diabetes tends to be, to me, a little bit more
tumultuous. Yeah.
Yeah. Good
yeah.
word.
It's like boom. Yeah.
So they sometimes can develop what we call DK, or diabetic ketoacidosis.
Yes, it's freaking terrifying.
Yeah.
I lose sleep over DKA.
I do too. Basically,
when you have a DKA dog, the first thing you'll notice is all the veterinarians on staff around a table with all the books open.
Yes.
That's how you know your dog might have DKA.
Yeah. It leads to it's pretty much, it is a guaranteed hospitalization.
Yeah, these dogs are vomiting,
feel terrible. They're literally in a state of acidosis, meaning like their body is acidic.
Acidotic. This is what people do to themselves on purpose with a keto diet, but because that they have a normal pancreas, they can overcome this. Yeah, and we metabolize fat better than dogs do.
Yes.
Okay, I wish you guys could see this because I'm literally sitting in my hairdresser's chair as she untangles the massive knots. If you can hear the weird sound in the background, that is my hair being untangled, because this is how we do veterinary medicine, is we multitask. So I'm really excited because I'm here with Christy, and she is going to give us her experience as a dog mom who recently had a pet diagnosed with diabetes. So Christy, tell us about Molly.
Molly is a 9-year-old Yorkie. She was first started having urinary problems.
Yeah.
Started kind of urinating all over the house. We're potty trained, have been for years, so I knew something was kind of up. And kind of all started from there, going to the vet and figuring out what was going on, and telling me it was urinary tract infection at first, and then come to find out later on, after she was not getting any better, that she was actually diabetic.
Right. And so how long was that whole process going on? Like the started peeing in the house to the point where the veterinarian that was originally diagnosing her is like, wait, this is diabetes.
Probably about 3 weeks.
Okay, so kind of fast.
Mm-hmm.
That's,
yes.
yeah.
Super fast.
It's weird because that's not uncommon. Like they're not diabetic one day and then they are diabetic the next day, which, I mean, at least it's like a cup overflowing type of thing. Like she was probably creeping up on it, but it hits like this threshold point.
Right.
So then you start trying some stuff, but it's not really working, right? So you're trying some oral tablets and diet stuff and we're dealing with the bladder infection.
Right.
And then you had an extremely intense initiation into diabetes land because you texted me one day when you were getting ready to, were you already on the cruise?
I was already on the cruise, getting ready for vacation to leave on a cruise, and my dog decides to be diabetic.
Yeah, so I wasn't Christy's veterinarian at that point. Like I've never dealt like with any of her pets before we talk about them, you know, in our hair appointments. But so she texted me kind of panicking a little bit, like this is not okay. And I was like, don't worry, I've got you. We're not going to the emergency hospital tonight. You're just going to come in. I've got plenty of doctors. We're good at this stuff. And so Molly comes in and she's in full on diabetic ketoacidosis, which is super scary. So tell me what she was doing. Like, how did you know you're like, we need big help?
She started throwing up everywhere on top of the urinating. She had lost a good amount of weight, a good probably 8 pounds, I would guess.
And yeah, she's only 14 now, so it's like 30% of her body weight.
Yes. And kind of she got to where she didn't want to eat anymore. And then we were also in a lot of pain, like moaning and groaning.
Yeah, right. So you send your sweet son up with this sick dog, and we end up putting her in the hospital, and she was there off and on for how, I mean, it was like
6 days
I was gonna
total.
say, yeah. So we tried to send her home once and just she wasn't quite ready, and so she came back, and we managed to pull her through a lot of DKA dogs. I know you and I have talked about it, but a lot of them don't survive.
Right.
So we were super grateful and happy that she put all that behind her. Now she's just what we like to call a normal diabetic.
Yes.
So what is life like with Molly now?
Well, she's more of a princess now than she was before.
Mm-hmm. As she should be.
As she should be. She went through a lot.
Yes.
She is kind of back to normal after, figuring all the insulin schedules out. We do that twice a day along with a, strict diet.
Yes.
Just getting all that figured out, and was kind of stressful at first, but once I knew what I was doing, it wasn't so terrible. She eats about every 12 hours, gets her insulin every 12 hours. Got the whole family, my daughter, my son, husband, everybody's
the
girlfriends
of the son,
Yep, everybody's learned how to do insulin shots. So that
all the vacations are now pet-friendly vacations.
Yes. Now Molly is going with us on all of our vacations, so we can give her insulin.
Yeah.
But it was a challenge, but we got it, and we're.
How long's it been now since we first since the DKA day?
It's been about 8 weeks, probably 8 or 9-ish weeks.
Yeah, so the first month was super dodgy.
Yes.
And now it's feeling a little bit more routine.
Yes, and I'm to the point where now, I don't really feel like I need to test her every day. At first, I was kind of nervous and was testing a lot and just making sure her levels were good. And now I'm just more comfortable, and I just kind of know what to look for if she's not feeling well, that maybe I need to be testing her and see what's going on.
Yeah, which is really cool. I was telling you earlier, too, not a lot of people get to the level of comfort with testing their own dogs at home. So I'm just super excited you guys are doing that.
Yes, that was...
It helped us navigate the dog food challenge.
Yes.
She's super weird because she can't eat the dry or her sugar spikes, which makes no sense because they're both diabetic diets. So
yeah, same food. One's wet, one's dry, but doesn't like the dry food.
No, her pancreas said, I will not be having that.
Yes.
Any of the dry foods.
Right.
Okay, so what would you say if you could just speak any kind of words to people who are living with a diabetic pet, or that, I guess knowing what you know now, what would you tell the Christy of 4 months ago about your pet?
Christy 4 months ago, I probably, when she started urinating all over the house, was already a telltale sign that she was diabetic already then. It wasn't just a urinary tract infection. And
although urinary tract infections can cause that.
This is true.
But yes,
I mean, I probably would have maybe had that tested for in the get-go, from the get-go, just so that maybe we could have kept her from going into DKA if we would have knew, maybe 2 weeks sooner.
Yeah, because it did happen super fast. Yeah, and I think also, with dogs especially, it's nobody's fault that a dog becomes diabetic. It just randomly happens. And we see it a lot more in Schnauzers than other breeds, so the Yorkie's not as common, but any dog at any time can become diabetic. They're type 1 diabetics, unlike people that are normally type 2. Cats are like that. Dogs are type 1, so their little pancreas will just tucker out, and either because the immune system is attacking it or whatever, but we don't have... I just want people to know that a lot of times it does happen really fast, and there shouldn't ever be any guilt associated with that happening.
Right.
It just happens.
It just happens.
And it's livable, right? So, you're still living a good...
We're still living. We're still doing the same things. Just kind of have to figure out our schedule sometimes with, obviously, got kids in sports, and we got to figure out, ahead of time, when we need to be back, or how we can maybe push out her feeding and her insulin shot maybe an hour, that we can be home in time.
And once they're stable, that's something that can be done, once you get through that little first initial hurdle. But
for sure.
So and then pet insurance, right?
Get some pet insurance.
That's right. Al pronto, because you never know when the diabetes is coming for you.
No, because she was happy and healthy, and now we are diabetic, but we're still happy.
We're still happy. But it's a game changer, and that's lifelong. So it's just one of those things. So words to the wise, get pet insurance.
Get some pet insurance.
So anyway, okay, well, I think that's it. Is there anything else you'd like to throw in? Okay, we can do it though. Yeah, if we find ourselves having to do it, we can do it.
Yes, and shout out to Northside for saving her life.
Thank you. Yeah, we all put in the hours on that dog. Some sweat equity went into Molly.
Molly, yes.
She's worth it. So, all right. Well, thanks for doing this talk with us.
Yeah.
All right. Bye.
Bye.
Okay. What an awesome story that we both just listened to.
It was wild. We didn't listen right now, no. But we have heard the story. We lived the story.
We lived the story.
And I'm so grateful for Christy to be brave enough to kind of tell it, because it was such a rocky road initially, and so getting to hear her perspective of kind of almost the very worst case scenario, and how that family has rallied, and now it's back to normal. Obviously we have a new routine because we have to incorporate shots every day. There's absolutely no way to avoid that for Molly ever again in the future, because unlike cats, dogs don't go into remission at this stage. They just don't have any little islet cells left making insulin, so we have to continue supporting her for life. But I have had dogs that lived for I think the oldest diabetic, I had a dog diagnosed around 10, and she died of unrelated causes at 17.
Yeah, I mean it's definitely variable, but a lot of dogs we can manage really well.
Yeah.
It
just takes a dedicated
new monitoring systems that we have.
Oh too. Yeah. So I don't know. I know it's slightly controversial, but I don't care. We use the Freestyle Libres because even on its worst day, it is still better than a glucose curve. Mm-hmm. And that's what we did with Molly. We didn't really talk about it in her interview, but essentially it's just like what you see in human medicine.
It's the same thing. Actually.
Yeah, it is the exact same thing. It's not meant for dogs, so they won't help us out at all if we need help.
That's not why. It's not controversial because it's not good to use it. It's just because it is made for human medicine. So we are extrapolating with putting it on the dogs and cats, but it is something that it's universally used in veterinary medicine now. Sometimes if they malfunction, they just won't like guarantee a rebate, basically.
Yeah, it was just super frustrating for our owners who have purchased the product and then it doesn't apply right or doesn't work right, and they're like, well, sorry, that's a dog, that's a cat. And you're like, well, fine.
You got us there.
Yeah. Agree on that point only. But what we do know is that, we've taken these dogs and tested them side by side. We've got this Libre that's reading on their monitor, and we're doing our in-house glucose checks, and they're matching within a few points.
Yeah.
Which is what you expect, because there's a bit of a lag time on the Libres because it's doing interstitial instead of actual capillary blood.
Yes, and the big thing with the Libre monitoring, we love to use it in dogs and cats, and is they're not stressed out at the clinic doing a glucose curve, which can affect patients' glucose levels. So, like, if your dog came in, or cat,
especially cats.
Yeah, and I did a comprehensive panel, and I printed it out and handed it to you, and it said glucose was high. It's probably because they had a stress response, which rose their glucose. It's not because they're
cats can throw up to 300 on their blood sugar and be completely normal, non-diabetic creatures, which is why the glucosuria and the persistent hyperglycemia are important factors
to the diagnosis.
Yeah, so that's just a little fun factoid. And so when you're trying to do a curve on a cat that's going to jump its sugar up by 200 points, that's not helpful.
No, definitely when you're using insulin.
Yeah. That's kind of our approach to it. Is we recommend the Libres, and then we really, really want owners to also get comfortable checking at home.
Yeah.
So, because they're not going to wear a Libre all the time, we usually just use that for initial kind of, I guess, startup dosing, that kind of thing, and then we redo it every 3 to 6 months depending on how the pet is doing.
But
like if the dog's having an off day, or cat,
do a spot check.
Absolutely.
And then that can roll into a curve if we need it to. So
absolutely, or a new Libre application or what have you. But you don't want to toy with dosages of insulins off a spot check ever. And owners are really tempted to do that.
Yeah,
don't.
Never do that. Spot checks are not. You can't change a dose on a spot check. And always consult your veterinarian before you change your insulin dose.
Please.
Yeah, because low. What we call a Samoji effect, which is a fun word.
Oh, yeah.
When you give too much insulin, it can look a lot like a dog who has...
not enough. If you give too much insulin, the body panics whenever it hits hypoglycemia or low blood sugar and will become insulin resistant for up to 3 days. And so then the dog will just be persistently hyperglycemic or high blood sugar, and so the owners are like, okay, well, let's give another unit. Meanwhile, you're just constantly just tanking this dog's blood sugar. And it's really messy to sort out.
Yeah.
So, please let us be a part of that decision.
Definitely. And that's another, advocate for the Freestyle Libre.
Yeah, it's because it's giving us that whole picture. You can see the dip and the plummet before the hyperglycemia, and then you're like, oh, I see that Samoji. Yeah.
So we can tone back or cut back a little bit on our insulin.
Absolutely. It's not cut and dry. Like these dogs will ebb and flow.
Yeah, exactly.
So we're taking these blood sugars into account. We're monitoring their weights. We're monitoring their appetite, their thirst and urination habits. All of these things that are going into our interpretation of how well regulated they are, and it is not like tiny people.
Yeah, no, not at all. And that's kind of like the dog picture is. It's going to be insulin. It's going to be injectable.
Yeah.
We're going to monitor with freestyles or curves if freestyles don't work for your family. And we'll, watch clinical signs. It's so important.
Yeah.
Because you can get hung up on a number, but clinical signs is definitely a big deal. So drinking, peeing, weight loss,
appetite, all that stuff. And the other thing I think is worth maybe saying is that diabetic pet owners, or the pet owners of a diabetic pet, they will get frustrated about how hungry the pet is, and they will feed them throughout the day. And when you're feeding a pet, when it's outside of its insulin usage point, right? So like that first hour or two especially, then really all you're doing is creating more hyperglycemia, which is going to then continue to confuse the dog's appetite center. They're going to feel hungrier, they're going to lose more weight, and you're just making more islet cells die.
Yeah.
And so you've really got to regulate their diet. You feed them the exact same amount of the exact same thing at the exact same time of day, twice a day with each shot. And the more consistent you are, the more that pancreas can cope with its struggles. So
to piggyback on that, we will recommend a diet change.
Oh, 100%.
So.
Yeah, just like any diabetic.
Yep.
Yeah, and then if you have multiple pets in the house, don't worry. Diabetic foods are safe for everyone. It's the things that everybody else eats that diabetics shouldn't eat, and that we probably shouldn't eat either. Just saying.
Yep. And typically the one we reach for is going to be the Royal Canin Glycobalance.
Yeah, that's what we do here. There are a lot of right answers out there, but we do Royal Canin because the palatability is nice. So anyway, canned or dry. But so back to Molly, it's super weird. And I think her mom actually mentioned it in her interview. This dog regulates beautifully on the canned, and then if you give her even just a few kibbles of dry, her blood sugar skyrockets. And we thought it was a fluke. We would have never figured it out if it weren't for the Libre.
Yeah.
But we thought it was just a fluke, so we tried it again. Nope. Dog cannot eat the dry food. Don't know why. It's the exact same thing. I don't know. It's how she's metabolizing the canned versus the dry, I suppose. But
that's amazing.
Yeah, I need to talk to the Royal Canin rep about that and be like, what?
Yeah,
is
that's
happening?
Weird. That is weird.
Now I'm nervous about every dog I have that's diabetic. Okay.
Or circle back around. So you had mentioned that your dog developed cataracts.
Yeah.
So when the diabetic dog does develop cataracts, because it's very, very likely, and it tends to be rapid.
Even if they're well regulated.
Even if they're well regulated, they will potentially develop cataracts. What can we do for them?
Yeah, so it's a great surgery because it's curative. You send them to an ophthalmologist and have cataract surgery done. And it's an outpatient procedure. They do really well. Currently, I think, around here. So I refer my dogs to Dr. Puckett in OVS, which is in Tulsa, because he's a wonderful human and a wonderful veterinarian.
Awesome.
Yeah, such a good guy. And he, I think it's around $3,000 for both eyes, because it's, usually both eyes. So,
yeah.
And I've had several of my patients go do that, and it's, it's curative. They see perfect. They have better vision than me.
Yeah. I've had good experiences with sending my diabetics to get phaco emulsions or the cataract surgery.
Yeah, not everybody opts to do that. Sometimes it's not in the cards, or the patient's too old, or there's just certain reasons why you don't do it.
Difficult to regulate. Then if you're not really well regulated, then
you can't do the surgery. If they're not well regulated, and so those dogs do fine. Unless they're a herding dog who needs to run out into a pasture, in which case that's not going to happen. They need to stay in an enclosed environment. Just hypothetically.
Fun side note. Dr. Puckett, I believe it was him. I was helping at the Oklahoma City Zoo with a seal cataract surgery.
No kidding.
Dr. Puckett did it.
No kidding.
Really cool.
That is really cool. How did the seal do post anesthesia? Because that's terrifying.
It is terrifying. So seal. This is a
way tangent.
Seal anesthesia is
bonus
terrifying.
Content.
Any like aquatic mammal anesthesia is terrifying because they have the dive reflex, which means that they'll just hold their breath for a really long time. Did well. She did great.
Yeah, because sometimes they won't start breathing again.
Yeah.
Because the dive reflex kicks in and they just won't ever take another breath.
So they flew in an anesthesiologist who specializes in a veterinarian anesthesiologist.
I wonder if he lives on Xanax or if he's just super chill guy.
No, all anesthesiologists are chill.
You've gotta be.
Yeah.
Wow. Okay. Anyway, so cats. Cats are type 2, so this is a whole different ball of wax. Diet change still incredibly important. I personally fall in a camp that's a little bit different in the sense that I really want to try changing these cats' diets before I do anything else, unless they're real sick. But if they're just my cat's drinking a lot, and I'm let's check the blood sugar, and it's a fat cat and it's got hyperglycemia, and we recheck it and it's still hyperglycemic, I'm going to change its diet before anything else, because so many of them will just go into remission. They just need a break, and so you give them a break and they're okay and you can reel it in. But there's also now, I'm going to let Dr. Dame just hold the reins on this wild ride. But there's a whole new avenue that we have for this middle ground cats.
This is just a preference, or to say before we get into it. Any cat who's on insulin can't go on these medications.
Yeah.
Any cat who is in that DK that we talked about,
sick,
can't really go onto these medications. So this is for a special cat. This is for a cat who comes in, is doing relatively well, but you're noticing we're peeing and drinking a little bit more, maybe losing a little bit of weight. There's 2 drugs out right now. One is Bexacat, which is an oral pill, and one is Senvelgo, which is an oral liquid. They both work pretty much the same. They are blocking a receptor, which is, that I'll leave it there. They're blocking a receptor in the kidney that is telling your kidneys basically not to pull out the glucose from your urine. So they are peeing.
Just let it go.
They're just letting that glucose go. And I have had a cat on one of these drugs, and it the next day had a normal glucose.
Yeah.
Which is amazing.
Yeah. And because that they are still secreting some insulin, then you're just giving relief to the pancreas. So it's not being constantly hyperstimulated by this hyperglycemia, and allowing it to kind of take a breather and start working.
Exactly. And because there's 2 receptors and it's only affecting one, they're still pulling back enough glucose to help their body do their normal stuff.
To not become hypoglycemic.
To not become hypoglycemic, which is our biggest fear with
all
insulin
of this
treatment, is causing the opposite, which is hypoglycemia from our hyperglycemic diabetics.
Yes.
So it's a really, really cool drug. It comes with its things that we have to monitor. So we have to watch, basically we have to watch for DKA.
Yeah, the ketones.
The ketones in cats. And what is kind of confusing about it, and what I'm going to start, if I ever put one of your cats on Senvelgo, because that's the product that we're going to have, there'll be some additional monitoring that we'll be doing, mainly monitoring ketones.
In the urine. And maybe some of the blood, depending on the cat.
Depending on what we do and depending on the cat, because that might not be fun to pull urine from it if it's not going to provide it readily.
Yay for lab litter!
So if we put your cat on this medication, we're going to be watching those ketones, because normally in a DKA, like we talked about, they would come in hyperglycemic and with elevated ketone levels. Well, now
they're not hyperglycemic.
They're not hyperglycemic. They are just in that state of acidotic. They're in that DKA without having the hyperglycemia. So when I put your cat on this drug, I'm going to tell you to really remember that. And I think we're going to try to figure out a way to make like stickers for the carriers or something. And I think our rep actually has some of them to say my cat is on this med, so that if your cat ever did become sick and you know, maybe we were closed and you went to an emergency hospital, they would know, okay, I need to look for DKA, even though we're not going to have that classic presentation.
Yeah, because the hard thing for us is that it's taking away the normal way we would diagnose something and causing us to look in a different way for the same disease. And so we just need to know that there's a roadblock on A, so you're going to have to take B.
Yeah. But there's a lot of cats already on this medication, and they're doing great, and the owners are only having to give an oral liquid once a day rather than 2 injections.
Yeah. And then these cats could still, like, theoretically go into remission. So they're saying, maybe like 6 months later.
Taper them off.
Yeah, once they're on their diet change and they've regulated and everything's fine, taper them off and see if they maintain on their own.
So exciting.
Yeah. Revolutionary, really, in terms of keeping these cats from having to go on insulin. Mm-hmm. So now I know you went to a seminar and they were talking about if a patient was diabetic, went into remission, hasn't been on insulin, can they become re-eligible, or that's controversial still? They're not sure.
Yeah, so because that population would be really tough to study, it is not on their label.
Right, yeah, you got a limited number of patients at that point to do your studies on.
Yeah, so you
would have to kind of go out on your own into the gray.
Yeah, that is a gray zone that they haven't commented much on.
Yeah, they don't want to be the one putting their neck out there.
Yes.
Got you.
Yeah. So it's a very specific cat can go on this oral medication. So I'm so sorry to everybody who's listening that already has a diabetic cat that's been on insulin. It's sadly not a possibility. And the risk there being, if you've been on insulin for a long period of time and haven't gotten into remission yet, the question is, how many good cells in your pancreas that are supposed to be making insulin do you have? Mm-hmm. Are you now insulin dependent, almost like you were a type 2 and became a type 1. So that's the fear, because if these cats are, in just quotations, type 1, and they go onto a drug like Cinvelgo, they're highly likely to go into that DKA that we talked about. So.
I guess, I have no problem with the gray, just to be real honest with you. I'm thinking of Fraggle, one of my cats, and he was early diabetic, went on to insulin, was on insulin for literally a week, was in full remission, which is a diet change. And so I'm like, I still, like, if he goes back into it, I think I would try Cinvelgo. The owner had asked me about Bexacat, and the studies really weren't, they were terrifying at the time. And Cinvelgo did, I'm just going to pick a side, because why not? I'm here, it's my podcast, I can do what I want. Right?
The monitoring.
Yeah, the monitors, it was a nightmare.
It was a lot more
intensive. Terrifying, yeah. And the education wasn't really there. They weren't really explaining how this was working. We weren't equipped to handle it. And so with Cinvelgo, they've done a much better job of circling back on that and touching all those areas that were just big question marks and hard, cumbersome hurdles.
Yeah, in their like FDA study that they did for Cinvelgo, there's the monitoring parameters are much more manageable for the owner and honestly for the veterinarian.
Absolutely.
That I think get you the same answer.
Yeah, because even with the urine ketones, they have that sand litter that's completely water. It's like hydrophobic, and it just boop, like little beads on the top, and you can easily at home check the urine if you just once every however often we need to, depending on the stage of the cat. But so it's just a really, really cool new option, and I just love the fact that veterinary medicine is still constantly evolving. That's why you got to get comfy in the gray.
Yeah.
This is a wild ride, folks.
It does constantly change.
Yeah.
Like, I've only been out of school for 3.5 years, and I'm like, wow.
I know.
So much has changed already.
I'm in year 13, or I guess maybe 14. I don't know. So I've almost been out for 14 years, and it's wild.
Yeah. I had a case like a year ago that I was like, this is what they taught us in school. And I was like, mm-hmm. And then I called a surgeon, and I was talking to him. He was like, "Oh, we don't do that anymore." I was like, I've been out of school for 2 years. My neck hurts. Like, excuse me? Like, this was like textbook. Like, I'm pretty sure I can open my textbook and it'll tell me that you do it this way. Yes. And he was like, no, we don't do that.
Yeah, you have two options in vet med. You can be humble or you can be out of date. Yep. Like, those are your two choices.
I choose humble. Yes. And so I actually, I called a couple other surgeons and asked them too, and they all gave me the same answer that they don't do it anymore. And I went, yep, cool.
Yeah.
All right.
Okay, cool. Love that for us. So, all right. Okay, so I guess that's all I've got for today.
That's all I have too.
Yeah, we have to go to rooms, I'm sure, but it was lovely chatting with you all.
Yeah, it was great.
Yeah, don't hesitate to reach out, and thanks for listening.
If your cat or dog is peeing and drinking more often, don't ignore it.
For so many reasons. Reference back to the kidney episode.
Yeah,
if you need more than one.
Diabetes episode. And
UTI. We haven't done a UTI episode, but if there were one,
we could do one.
Yeah.
Little like cap before we leave. When I like come back into the room after I do your lab work, and I go, "Can I get urine?" Please say yes, because I'm either trying to figure out, does the cat have chronic kidney disease, or or
diabetes?
Is the diabetes real, or is it just a stress-induced?
Yeah, absolutely. Yeah, it's not for fun.
It's not for fun.
That's not why.
I don't want to take the urine, but I do need to know.
Well, yeah, this is important.
It's
a little piece of the puzzle. It is out of love. Yeah. All right, cool guys. Well, I hope you have a great rest of your day. All right, bye.
Bye.